Hi there, Jacki St here, your favorite, of course. Here with Jennifer Brooks of Horse and Hound Physical Therapy in Nashua, New Hampshire. We had to stop in, it's so close to our own hometown. Tell us a little bit about what you do, what you got started with.
Sure. Well, I'm a physical therapist for over 25 years in the human realm.
Okay.
And then in 1999, I was a little disillusioned with human physical therapy in the insurance industry, so I started looking back to my passion, which is horses, and I'm an equestrian from being a little kid. And I came across a University of Tennessee equine rehab program brochure, and I went back to the University of Tennessee and I got a certification in equine rehab, and have since started my own practice in 2006. It started with equine rehab services, and then I went back to the University of Tennessee 2 years ago to embellish my equine practice with canine, and since then I've opened up Horse and Hound Physical Therapy in Nashua.
Wow.
And so what we do is treat dogs and horses, and I've treated a few alpacas
I thought
also.
It was like rhinos and elephants or something crazy. I wasn't sure.
I also treated an elephant long distance.
Wow.
So there's a few animals. You know, if they're a quadruped and a mammal, we
Right.
treat them. So we take therapeutic intervention, such as therapeutic exercise, the use of modalities such as a laser, therapeutic ultrasound, so similar to this product. This is a low-dose ultrasound. And we've applied them to the horse or the dog or other animals as needed to promote healing, to decrease pain, decrease inflammation. All these things that we know work so well with humans also work for our animals. And there's been, in my mind, a fairly large gap between what veterinary medicine offers and what the humans expect of their animal back to high performance, that there's a little bit of an area of gap, which I call your subacute potential for rehab. So that's when rehabilitation and physical therapy is most appropriate, is trying to get in there after the veterinarians have looked at the animal, given a diagnosis, done whatever medicines or surgical interventions they can do. And then there's that phase of healing where we can work on flexibility, strengthening, pain reduction, a lot of education to the owners, and help that animal get better faster.
Now, do they have to come to you or do you come to them?
Great question. At our facility here in Nashua, we do treat small animals, so dogs and cats. In the horse world or larger animal, I go out to the barns and go to where they live. It's safer for them and they're in their own environment. And again, I do as much as I can do intervention-wise of educating the owner, what they might be able to do, and then see the animal accordingly as to how often they need it for progression.
So what are some of the most common things that you see? For example, since how we're doing mostly horses, I know a lot of horse people have dogs, but we'll focus on the horses for today. What are some of the most common things that you have to help with?
Yes, great. With horses, we see a lot of back pain, hence the spines that I've brought here for helping with education for the owners. So we see a lot of back pain, so we work a lot on strengthening the top line, strengthening the core, and again applying whatever modalities are necessary to reduce pain along the spine. Also, a big area that I treat is stifle dysfunction. So there's a lot of horses that are having intermittent upward locking of the patella. And I have a program that's been very successful with very many horses in terms of hind end weakness. And with the stifle problem, it's often a biomechanical problem, so that the patella is not releasing properly due to weak neuromuscular contraction of the muscles around the patella and the hip. So again, I've come up with a therapeutic exercise program that seems to be very successful with many horses.
Is there any way that you could show us or explain just briefly?
I just happen to have a stifle right here. So this would be a left leg, mimicking my left knee, and this is the patella. This is the medial condyle of the stifle. And what happens is that this patella rides up and down as the knee flexes and extends. And then when the horses want to stand, prolonged standing, they put the patella, lock it up here on top of the medial condyle. The problem is that the release mechanism is not as high functioning as it should be with many weakened horses, whether they've had a suspensory injury down below and they've just had stall rest, so they get weak up above. And so this patella can get stuck and cause a multitude of problems for horses, one of which is leading towards degenerative joint disease.
And pain, I'm sure.
And pain. And the more it gets stuck, the more they wear down the cartilage, and it becomes a self-propelling, I can't think of the word.
Inflicting?
It's just a downward spiral.
Right.
And so, again, if you strengthen the muscles up in the hip, up in the pelvic limb, the quadriceps, the bicep femoris, All these muscles, as they get stronger, start to control this patella much better, and you get a much nice, smoother movement of the mechanics at the knee or the stifle of the horse.
Okay. Very cool.
Okay.
It's very interesting. Tell me a little bit, just a random fact. What's the best part of a sandwich?
What's the best part of what?
What's the most important part of a sandwich?
The sandwich. The cheese.
The cheese. What kind?
Cheddar.
Okay, I had to throw that random one in there, see if she was paying attention. Tell me a little bit more. So, I know a lot of show horses get injections in their hocks, stifles, ankles, whatever it may be. Is that anything to do with physical? Can you help that, or is it only after they get injected? Or
no, people will pursue injections for a multitude of reasons, usually for swelling and pain, and usually some arthritic changes in the joint. And there's a variety of different thoughts about joint injections, and there's some positives and negatives to it. It can be very helpful to decrease the pain and the inflammation that the horse has experienced, so that's a good thing. The problem is when they get overused and you start injecting joints regularly. The potential there is that there's something called the joint capsule where that synovial fluid is, and that's where they do the injection. Well,
that's full of vodka, right?
Vodka, no, synovial fluid. Vodka might help at times, but so when they inject that area, you can't help but get a little bit of expansion of the joint capsule, and that repeated joint capsule expansion is actually going to be detrimental in that it's going to loosen the joint. When you loosen the joint, you're going to get more friction. You're going to create more of the problem with this lack of integrity in the joint. So that's the problem. But used judiciously, joint injections can be very helpful, and many horses will get kind of over the hump, so then they can get back to an exercise program to get better.
So what can you help with as far as?
The strengthening aspect. Okay. Trying to keep the horses limber through flexibility, stretching, and then also strengthening programs, which are very specific, written out in the realms of how I give them to people, so that the horses start where they're at, whether it's, all horses have a different level of performance that they're tolerating, or they're very deconditioned from prolonged stall rest. So I prescribe the exercise programs according to where the horse's conditioning is at.
So that could be before, after, or during the joint injections.
Yeah, joint injections can happen at any time.
Okay.
And like I said, variety, they're good for certain things, but overused, they can be detrimental.
Definitely, just like anything. Awesome. Especially like cheese. I mean, you eat too much cheese, it's going to be a problem. Well, thank you so much.
You're very welcome.
Nice to meet you, Jennifer.
Thanks.
Hey there, we are the three fillies of Horse-A-Day.
Chris, Tina, and Jackie.
We would love for you to check out some more of our videos and interviews at horseadayblog.com.